One of the things that I think is important to talk about before we actually go into just talking about sex is HIV is now a chronic condition. It is a condition in Australia that we manage chronically through medication. We model it more similar to diabetes than we do something that within 5 years people die. That does not happen anymore. And when anyone says to me they've come in for an AIDS test, we want to clarify AIDS is one thing, HIV is something else completely different. And we rarely see AIDS in Australia anymore. And I don't know if you're aware, but there has been a recent study and we have done what's called PrEP, which is a preventative medication that protects people against HIV transmission. We have a lot of HIV patients who are currently on medication to keep their viral load nice and under control. And what we're finding is with a good control of HIV and good protection against HIV transmission, it's coming together and we're basically looking at eradicating HIV within Australia. There will still be HIV, but statistically HIV should be pretty much resolved by 2020 in Australia, because we're one of the gold standards in the world in relation to HIV management. We should be very proud of that. And that occurred because of needle and syringe programs in the 80s and methadone programs in the 80s. A real push from the health department, Liberal and Labor, to bring together in the early 80s to make sure that HIV transmission was reduced. And so in relation to IV drug use in needle and syringe programs in Australia, 1.2% of IV drug users are HIV positive. In New York City, 40%. So you do the math. So when we talk about safe countries to be in relation to transmission, USA sadly is not one of them. You can edit that if you choose to do that. So we're a free service, we are confidential, we are safe. If there is a reporting situation with any young person, we are mandatory reporters and we are required to report, but we also look at the circumstances and the situations. But we are confidential. A person can come to us from anywhere, they can ring us up on the phone, we are on Health Pathways, you Google Sexual Health Service Illawarra, we'll come up. They can walk to the window and say, I need to come and see you. You can be referred through your GP, you can be referred through your specialist. There's 1,000 different ways you can do it. You do not need a Medicare card. Be nice if you did, because it helps, but we see a lot of refugee, we see a lot of people who may not necessarily wish to be known, because we are what's called a public health or a health prevention or a harm minimisation model. What we look at is that we would prefer, and it's a well-worn statement, we would prefer the fence at the top of the cliff and the ambulance at the bottom. So what we do is we're a one-stop shop in relation to ensuring that people come to see us, and if there is a health issue, a lot of our infections are publicly notifiable diseases like the measles. Chlamydia is also one of those. So we need to make sure that we reduce that transmission. So that's one of the things that we do.